Thank you very much, Mr. Mpela. And my appreciations to the presence of our Director General and the Special Advisor as introduced. I want to greet you, members of the media who are here, and all South Africans at large, wherever they are, this morning. We meet at a time when our country is being ravaged by the coronavirus, which is better known as COVID-19. It is especially important in a period like this to reflect on the fundamental values enshrined by our Constitution upon which the South African state is founded. These values are an embodiment of our aspirations as a people, premised on, among others, human dignity, the achievement of equality, and the advancement of human rights and freedoms, non-racialism and non-sexism. In advancing these values, Section 195 of the Constitution of the Republic of South Africa, adopted in 1996, requires that the public administration be governed by principles that require the following. Number one, a high standard of professional ethics, that it must be promoted and maintained. That services to be provided in an impartial, fair, and equitable manner and completely without any bias. It requires the promotion of efficient and effective use of resources of the state. A developmental-oriented public administration and an accountable public administration. And I want to emphasize these principles even at a time of crisis, that we are alert and we are doing our best to ensure that we maintain all these principles as enshrined in our Constitution. The work of the Ministry and the Department of Public Service and Administration is informed by these basic values and principles governing our public administration, and place the Ministry and the Department at the center of building a capable, ethical, and developmental state. And this requires us to modernize government, focusing on, among others, innovation and efficiency. The enactment of the Public Service Act 1994 ushered in a new era in the South African public service, premised on transformation and a new democratic dispensation. In seeking to entrench the constitutional values and principles outlined above, the public service adopted the Batuphile principles with the vision of a better life for all South Africans by putting people first. And we need to remind all our public servants all over where they are that each one of them out there have a personal duty over and above that imposed by the department on behalf of our government to ensure we uphold all these principles of Batuphile, summarized as putting people first all the time. Academics and politicians globally have debated the role of the state over time, including at times of upheavals and instability. The role of the state has shifted to the spotlight depending on how effective it discharges its current responsibilities under the current circumstances we find ourselves in. The state may re-evolve. When COVID-19 outbreak attacked humanity across the globe, the question arose, what should the role of the state be? And the second question has always been, how will the state respond to this crisis? Now, these two questions, as I say above, have put the whole question of the role of state on a spotlight. In our case, the state sought to protect the citizens against primarily the infection of COVID-19 and the harsh effects on the people, whilst also supporting the economy during a time when restricted movement was necessary. Our state, represented by our government, has provided decisive leadership in our fight against COVID-19 and at all times cognizant of our constitutional obligations, and government has ensured, number one, accountability and ethics. Government has had to take various decisions to support its citizens, but that had to be done in an accountable manner through consultations with stakeholders in the public sector, in the private sector, in the academia, business, and society general, and all measures requiring the highest ethical standards. We have had to collaborate with experts, and we have seen the benefits of the state acknowledging, recognizing, and ensuring that we are guided in most of our activities, particularly on COVID-19, guided by expertise that comes from those who are experts in the health sector, but also in the public sector on related services. So government has had to perform its obligations in a manner that is evidence-based or evidence-driven, taking into account contributions from these experts. And I think all of us in the country see the benefits. And we in public administration want to value these contributions by our experts in delivering this particular service and other services that we have a responsibility to deliver to the people of South Africa. The value of expertise. On greater policy certainty, we based our approach on a broader policy of providing health care to all and providing financial support to all citizens based on need and affordability of the state. We also endeavored to be prompt and to be very decisive in our decision-making in relation to lockdown, which is now known throughout the world that the South African government, led by President Cyril Ramaphosa, took prompt decisions on this matter to delay the spread of coronavirus by taking a prompt decision or an early decision to lock down. And there were other various decisions that were taken thereafter in relation to funding and criteria thereof of business and individuals who needed assistance in this particular period. There were prompt issuing of disaster management regulations, which were aimed at curbing the spread of COVID-19, and also other regulations in relation to the economy and supporting those who were in need in that particular sector. And this goes on to include employees that were in need of support after businesses got affected by lockdown. We also endeavored to be very efficient in implementing whatever decision would have been taken by Cabinet in relation to COVID-19 and we have sought to enhance the value, and we recognize it, of efficiency, which we still have to make an effort on as a country, particularly in public service. Efficient implementation of all decisions taken. But finally, we see the value, and we've always endeavored to make sure that we build capacity of public servants, which were hard at work and are doing it at the moment. Public servants have been, during this COVID-19 fight, capacitated through a plethora of guidelines, especially those on the front lines, and of course skills relating to COVID-19. And the issue of PPEs remain a concern in some areas and is receiving the attention of the Department of Health to ensure the safety of frontline health workers and to facilitate this on this matter, to facilitate accurate response depending on the circumstances where these PPEs are needed and what kind of PPEs are needed, in which circumstances. Stakeholders in specific facilities, especially health facilities, are encouraged to ensure alertness of the Department of Health on their needs. So let's engage out there. Let's raise our hands out there. Let's speak out there on these needs, because it is difficult, as it has been proven, to ascertain at all times what is needed where, because of different circumstances where frontline health workers are working and are called upon to deliver this health service. Public servants have been rendering exceptional services to South Africans in various fields such as health, defense, immigration, safety, among others. Our state has progressed from serving a few to serving all citizens in this country, especially since 1994. This is usually evidenced during the month of September each year, when we honor public servants by celebrating Public Servants Month. However, our true test as the public service will be how we support the citizens of our country during this period of turmoil, where dependence on the state for services will be especially higher. We take this opportunity to honor all our public servants in the country, especially those who are not working from home but are occupying the front lines and offering support to the people. Well, we also take this opportunity to honor the heroes and heroines who, in the course of their duties, pass on. And we say to those, may God bless their souls, and our sympathies to all their families. The COVID-19 invaded South Africa at a time when government was hard at work to revive the declining economy. We were busy fighting poverty and hunger and improving the conditions of our people. In the past, we have endured the number of challenges, including TB and HIV and AIDS. But so far, the COVID-19 seems to be more daunting, especially since there are so many unknowns about this disease. The current positions we find ourselves in will test the capability of the state more than before and to the maximum. We are hard at work doing an overall interrogation of the current capabilities of our state in a number of areas to assess, adjust and adapt our operations for the future to deliver optimally in regard to services during any pandemic, including this one. At this stage, it becomes relevant to borrow from Abraham Lincoln, and I quote, "The dogmas of the quiet past are inadequate to the stormy present. The occasion is piled with high difficulty, and we must rise with the occasion. As our case is new, so we must think anew and act anew. Close quotes. As we move through the various alert levels, we need to plan for the normalization of the public service. On the 23rd of April 2020, President Cyril Ramaphosa announced a risk-adjusted approach to slowly unlock the economic activities in some sections and phases, easing some of the restrictions effected during national lockdown placed on the 26th of March 2020 in response to measures needed to contain the spread of COVID-19 pandemic in the country. The phased strategy consists of 5 levels, detailing how activities will be opened up to bring back some normality, whilst taking cognizance of the presence of the virus with level 5, referred to as the lockdown phase. The country is now at level 4, and level 4 allows for the easing of some of the restrictions put in place during the national lockdown, thereby gradually unlocking certain economic activities to resume without compromising progress made in the containment of COVID-19. During this transition between the levels, the focus of public services continuously to ensure the provision of services required for the effective functioning of government and to ensure necessary support for all sectors that will become incrementally active during the various levels. For government to facilitate the unlocking of the economy, there will be a need for more public servants to return to the workplace to provide services that will be required by those sectors that are part of the level 4 phase, over and above other basic services that were part of the critical and essential services during lockdown period and level 5. The Department of Public Service and Administration has issued many circulars, the latest being Circular 18 of 2020, to the entire public service that details necessary measures which national and provincial departments ought to implement to ensure the containment and management of COVID-19 in the public service. In developing the circulars, we took into consideration various relevant laws such as Basic Conditions of Employment Act, the Disaster Management Act, Labor Relations Act, Occupational Health Safety Act, Public Service Regulations 2016. The department will be working, over and above this, the department will be working on a framework that articulates details and norms and standards that should apply to many public servants that would be working from home. So we need this particular kind of framework that will detail and guide the behavior and the standards and norms that should apply as public servants work from home. We will be embarking on that one. These circulars provide guidance on occupational health and safety measures required within a workplace to contain the spread of the virus as and when public servants come back and normalize public service. Amongst the provisions in this circular require departments to set up internal COVID-19 steering committees to put in place implementation plans at the different levels of alertness to demonstrate how departments will ensure service delivery with sufficient capacity for government services to return to normality, while ensuring necessary precautionary health and safety measures. As a directive, departments are reminded that all employment conditions and agreements are to be observed with necessary flexibilities of working from home. Care should be given on all pertinent issues, including leave arrangements for employees and reporting mechanisms in relation to gaps caused by lack of laptops for each employee. What we're referring to here is that other employees, especially those that are working from home, don't have laptops in relation to the work that they need to do, and in relation in particular to leave arrangements and other work-related activities. And so heads of departments need to make sure that they close all these particular gaps while ensuring that work continues. COVID-19 committees must continuously monitor the implementation of their department strategies, risk assessments, workplace procedures, and systems to counter the spread of COVID-19 and provide the response reports to the National Steering Committee. And at this particular moment, I just want to take a pause and report that we have written to the chair of the Public Service Commission in relation to the statement that was made the other day to the Portfolio Committee that the Public Service Commission doesn't appear on the regulations as a department rendering essential service. And I want to clarify that the Commission is in a category of departments that are required to ensure, among other things, that government business continues. And that's why, among other things, they were at the Portfolio Committee on that day. And we've clarified the matter with the chair of the Public Service Commission to enable them to resume their work, and especially in determining on their own what is essential in their circumstances and embark on those as it were. All Directors General and HODs are directed to ensure that all health and precautionary measures to prevent and contain the spread of COVID-19 are adhered to in their respective departments by implementing systems that will manage issues of hygiene and social distancing upon return of employees to the workplace. Given that during the lockdown period, government operations were required to continue, and departments had already identified the critical services that required employees to be physically present at the workplace, while others were adapted to online services or remote working, it is advised that with increasing demands of the easing of the lockdown, departments may need to identify more employees responsible for such critical services and recall them back to office if necessary, supplement capacity. In line with the recent circular issued for all DGs and HODs, departments must develop a schedule for a staggered return of the workforce, which will assist in managing the number of employees at the workplace, at the same time to maintain service and business continuity. The schedule must be disseminated to all employees and to be relevant sectors in support of the restart of the economy and other related activities. DGs and HODs must ensure that employees who are required to be at the workplace be issued with requisite permit authorizing travel for workplace purposes. To limit the number of employees arriving, leaving, or working at the same time, the DGs and HODs should consider amending working times to minimize the risk associated with simultaneous arrival and departure of employees. To reduce the number of employees at the same time in common areas such as kitchens and canteens, the staggering of employees' meal intervals and other related activities should be considered. On remote work arrangements, as indicated above, social distancing is an important consideration. As such, remote work has become an important mechanism in the fight against the spread of these COVID-19 diseases. And that's why we've made a reference to the need for us to developed a detailed framework of norms and standards so that people are conscious all the time that as they work from home, there are certain expectations in terms of their work or the work that they need to do while at home as a result of the outbreak of the disease. Where employees can work remotely from their homes, departments are encouraged to continue with this approach, taking into consideration the requirements as outlined in Circular 15 of 2020 with regard to critical and essential services. Further, the departments are urged to strengthen such capabilities by ensuring that employees have necessary resources for remote work and productively utilized. It must be clarified that although employees may be working remotely, they may also be required from time to time to attend the workplace as may be necessary, to, among other things, receive instructions, documentation, access office infrastructure like desktops and other things, and to submit completed tasks where relevant. DGs and HODs must make a determination on employees' readiness to work remotely, of course, bearing in mind the higher risk for COVID-19 that COVID-19 poses to older employees and those that present with comorbidities. Those employees will be expected to submit evidential documentation to their human resources so that there's common understanding of how such conditions need to be managed. It will be necessary to go to detail on those with their relevant supervisors. The decision on remote working must be made with due consideration to the service delivery needs of the departments. On workplace preparation in response to the easing of the lockdown incrementally, as departments prepare for the opening and return of employees, which is not now, a thorough cleaning of the workplace will have to be undertaken to ensure it is clean, hygienic, and that all guidelines outlined in Circular 7 of 2020 as they pertain to the preparation for the containment and management of COVID-19 in the public service are observed. These will include temperature screening for each employee entering the building and mandatory wearing of cloth masks at all times in the workplace by non-medical personnel, placing of hand sanitizer strategically at all entrances, common areas, doorways, lifts or elevators, escalators, handrails where office equipment is shared, etc. Visits to the workplace by non-employees must be by prior arrangement and only where absolutely necessary. These exclude service recipients at service delivery points. The detail of such visitors must be recorded for track and trace purposes all the time. All employees whose operational requirements require personal protective equipment should at all times be provided with such. In assisting employees who need support in relation to the impact of COVID-19, departments should ensure that the requisite employee assistance programs are available to offer such support. As we conclude, government further urge citizens to utilize online services where available so as to lessen physical interaction and minimize the risk associated with the transmission of COVID-19, while trying to bring in necessary services back into operation. COVID-19 remains a threat to everyone, and therefore extra care should always be exercised by public servants who are performing their duties during this challenging period. And we urge all public servants to be ambassadors of government in relation to alertness of the danger that all of us are facing. Public servants should shed light to all citizens and honestly do so against all wrong assumptions that are out there that we are often coming across, where people tend to make, in certain circumstances and areas, wrong assumptions about the disease. So we expect our public servants, among other things, to ensure that they spread the correct alertness of the public on this matter. It is worrying to note that to date, there are 511 health workers that have been infected with the virus, including a doctor and a nurse who have lost their lives, among others. At this juncture, we would also like to express our gratitude to essential and frontline public servants for their sterling work and the challenges we are going through as a country. Their dedication and commitment give us hope that we will turn the corner in the light against COVID-19 and should serve as a reminder to public servants that we belong to our communities. We care, and then we serve. This is our motto as the Department of Public Service and Administration. Thank you very much.